Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no copay. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you.
Discover a new path to wellness at Arizona Metabolic Health. Dr. Brian Lenzkes offers advanced medicine and personalized care, treating the root causes of your health concerns, not just the symptoms. Whether you're seeking direct primary care, effective diabetes management, or medical weight loss, with a holistic approach, our team is here to guide you every step of the way. Visit ArizonaMetabolicHealth.com today to learn more about our innovative health solutions.
Hello, everyone. October is here. You believe that? Oh my goodness, it's the scary month where black cats and witches and goblins and all that kind of stuff. But we don't have to be afraid of the food. Stay away from those processed foods. And to help you do that, if you get a sweet tooth when all your kids are out trick-or-treating, Health Code's here for you. They have tons of recipes on their website, well worth going to check out. They do, the chocolate macadamia and the vanilla, and you can make it into all kinds of stuff. My favorite are the maple bars. Amazing. Just make a bunch of them, cut them up small. And when the kids are eating those terrible things that are making their teeth rot, you could have a healthy alternative. So Health Code, thank you so much. And my discount code with them is MedHealth, METHEALTH. Go check them out. Thank you. Hello and welcome back to the Life's Best Medicine podcast. Today I've got a good one. I always say that, I know, but this time I really do. Michelle Hurn, welcome. The dietitian's dilemma, a dietitian who goes through training, and then all of a sudden you sit there and go, oh my gosh, so much of what I learned is not true. Let's talk about that. Let's start off with that. Like, how did you get to be the outlier? Were you always kind of questioning the authority type person, or did this just kind of like, how did that happen? Just so people who are listening know, being a dietitian, because it was super risky, right? To step outside the box and say, oh, I don't think I see it the way the rest of my profession does. So
yeah, I've definitely been somebody who always questioned things, like even as a kid, like, why does this make sense? And yeah, briefly, I had a pretty serious eating disorder when I was 12. I was 5 feet tall, 57.5 pounds, went to inpatient treatment. And that was like my first exposure to a dietitian, and even back then, I remember them telling me things. I was like, this doesn't really make sense. And, I was put on a 24-hour tube feeding system. And back then, the ingredients for tube feeding were maltodextrin, corn syrup, canola oil, soy protein. Today,
they still are, aren't they?
I was going to say, fast forward 30 years, I was 12, I'm 42 now. They're the exact same. And yeah, when I went through the dietetics internship, same, just things didn't make sense. Like, we went into the room of somebody with type 2 diabetes, and my preceptor would say, like, hey, we're going to teach them to eat carbohydrates consistently throughout the day so they can dose their insulin consistently throughout the day. And so I would just ask questions. I was like, well, if their blood sugar is high, should we teach them to eat less carbohydrates? And I was kind of pegged as this like difficult dietetic student. But yeah, I started working in acute care after I graduated, and I just saw the revolving door of sickness, and people weren't getting better. If anything, people were getting worse. People would come in with infections pretty soon, diabetes, kidney failure, heart failure. But it wasn't really until I had my own health struggles in 2019 that I was like, okay, I've got to make a big health change. And then once I, embraced the low carbohydrate diet, it changed my life. So then you go down the rabbit hole, right, of learning like, oh my gosh, like, this has so much healing power and potential, yet it's not prescribed just because, the American Dietetics Association and certainly like, doctors and other things are just not taught this information.
It's maddening. I just saw, excuse me, Kennedy yesterday said, look, 70% of diabetes is reversible, type 2 diabetes. And I was like, oh my gosh, if that's true, like, how come the ADA doesn't want to talk to any of us? Like, I had an in at the ADA and the guy's like, yeah, unless you're from an academic center and you're like published multiple times, they don't want to talk to you. I'm like, isn't it good to hear opposing viewpoints and we look and see who's doing better?
Oh, 1,000,000%. Like even when I was, a young dietitian, I was told type 2 diabetes is, a chronic disease. It doesn't get better. It can be managed. I was never taught it could be reversed. And, working with Dr. Mariela Glant at Ona Health, I mean, and I'm sure you've had incredible results. I mean, we had a guy, his A1C was 10. And within 71 days on a low carb diet, it's 5.4. Like incredible result. I mean, I had patients in acute care that were diabetic for like 30 years.
Well, not only that, Michelle, it was like, we were seeing Tro and I were seeing people's moods get better, depression, anxiety. We think this is wild. Like, why are we seeing this? As a matter of fact, I was just at a conference with the makers of Fat Fiction. And I said, what are you working on now? Like she just did one on cholesterol, how they've been wrong. She did the Fat Fiction, which showed the ADA's diet versus a low carb diet with continuous glucose monitor. You see dramatic improvements on a low carb diet versus the standard of care. And she said, I'm really working on depression. I want to see something on mental health issues with changing lifestyle. I was like, you know what? You already have, like, I had 5 patients and all of them started crying, saying that the biggest improvement they had was in their mood. Not even though they lost weight and they reversed their diabetes, they're like being able to smile and laugh and have fun again. I said, you have all that on your cutting room floor because it was too controversial at the time to talk about, but it's there.
Yeah,
So
Dr. Sati Shabani, when she published her case study with binge eating disorder and remission of binge eating disorder with therapeutic ketogenic diets, there's a small paragraph in there that I've told her, I was like, oh, I should have focused more on that. But obviously, the big deal was, the patients had remission from binging. They also lost weight. They were all morbidly obese, but there was statistically significant improvement in mood. Like that's a huge thing. Having quality of life, isn't that what we're all going for, right?
yeah, and that's a hard thing. I mean, you're obviously an expert because you've experienced all these things like with eating disorders, and that's when we start talking about low carb diet, they go, that's an eating disorder right away, and saying, well, what about the binge eating they're already doing and the anorexia that we're fighting against? So now we're seeing benefits if you take out the processed food and sugar that people's brains work better.
1,000,000%, and it's interesting because all these disease states, whether it's type 2 diabetes, whether it's eating disorders, I mean, you name any chronic disease is getting worse, right? Like the numbers are getting worse. We're not seeing improvement. I think it'd be one thing if it was like, yeah, we're seeing this massive improvement with our current regimen, but I'm always curious why people aren't open to alternative options when theirs is clearly not working, and we don't have the data,
Yeah. Yeah, how can you I really how can you be the ADA and see the absolute disaster? We're having little kids for the first time having type 2 diabetes, and they're 8 years old. And
Yeah.
you think, how can we not look at this and go, okay, our recommendation, either because the mindset is that no one's listening. No one's listening and they're just doing their own thing anyways, but they are listening. That's the problem.
Yeah, and we proved at Ona Health, and I know you and Tro have, that people are listening when people are given the right information. I had a woman like bawling her eyes out because she's like, nobody has told me, that my type 2 diabetes is reversible. And she might have gotten a little bit of like arbitrary, like eat healthier, like whatever that means, but she was, Hispanic. She was on 200 units of insulin a day, Dr. Lenz, and I mean, her blood sugar was still in the 300s. Like that's how severely insulin resistant she was. But putting her on a low carb diet, she said she's like, me and my boyfriend went to Walgreens because we're like, this is wrong. Our test strips must have expired. Like I've never seen blood sugar this low. And once again, removing removing what's causing the problem can vastly improve things.
Yeah, let's switch over for a second here. What about the American Diabetes Society? What are you all doing over there?
Yeah, so it was Dr. Barry Ken that texted me and was like, "Do you want to do something cool?" And we just like, "Okay, this is last year, sure. What do we want to do?" And he said, "I have this idea. The American Diabetes Association is giving people the wrong information. They're sponsored heavily by pharmaceuticals, and so he's like, what if we started the American Diabetes Society, just to give people an alternative approach. And the goal being like, we don't want to manage type 2 diabetes. It's wild to me that the association's slogan is connected for life. Like, we don't want to be connected for life. We want you to get better and get on with your life. And so it's been an honor. It's myself. There's 3 other dietitians: Temple Stewart, Shannon Davis, Shanna Hudson, and incredible doctors. I had Dr. Berry, Dr. Hampton, Dr. Mariella Glant, Eric Westman, and Ben Bickman. And so we've all just, bringing our collective experience, want to make low carbohydrate education just attainable. Like, to say, hey, you can do this. Here's some recipes. Here's some information for your doctor. Here's some short videos you can watch. Our goal is to empower people so once again, they can heal. And you can do that when you're not sponsored by pharmaceuticals. I mean, that's the reason the association, I'm sure, hasn't moved. That's the reason our nutrition guidelines haven't moved, right? I mean,
Well, it just tells you, if you say someone's having success, they bring that person in and let's hear what you're doing. I mean, it's just amazing. We may not agree with you, but let's see and try to pick your arguments apart. But when you have clinical data, and that's why we started Low Carb MD podcast, is to have all these different practitioners around the world saying, here's what I'm doing, here's what's working. And so people can at least hear it, right? Because it's a big, huge problem. Like what you alluded to that also. It's like, okay, you're the ADA and you're sponsored on this side by pharma, this side by big food. Could you imagine if the Mothers Against Drunk Drivers was sponsored or taking money from Cuervo, right? Like, people would flip out. Like, you look at the conflict of interest, you think, how can this possibly be? Where you're saying, oh yeah, drink soda, but you just exercise and that'll be fine. Wait a minute. like we know the problem, and it's just amazing to me that we haven't stepped back and said, let's take a breath and see where our money's coming from, who's sponsoring us, and what can we say and not say.
Well, and you're also fighting a highly addictive substance, right? And you're also fighting a culture and society that likes quick fixes, likes things easy and fast. And so you have the drug with the food, you have the sugar, so you're giving that to people and then they're getting sick. And then you have, we'll fix it quickly with metformin, with now these, we can talk about GLP-1 agonists. And so it's like the perfect storm to make people astronomical amounts of money, but to make people, incredibly sick.
Yeah, let's talk about that, because I heard you talking about Yerba Mate. It's a product that Ben Bickman's talked about, you've talked about, and I was like, let me listen to this and see. So tell people about this and a natural type of GLP-1.
Yeah, and I'm always really skeptical of supplements. When I first heard about Yerba Mate, was actually from a dietitian. They said, hey, there's this Yerba Mate concentrate. It's got, 365 the times the amount of chlorogenic acid as regular Yerba Mate. It has all of these really positive metabolic side effects, everything from increasing ketones. It increases your own endogenous GLP-1 by up to 50%, increases fat oxidation, is a very anti-inflammatory compound. And I was kind of like, yeah, really, like a tea, when I've heard of this, like, is that really going to make that big of a difference in metabolic health? But I talked to Dr. Bickman, since, he's on their science board, and he said, we've seen incredible things with Yerba Mate. And I was actually really surprised when I started researching it. There's actually several clinical studies on it, on its ability to help you oxidize fat, on its ability to be very anti-inflammatory. And so, I did kind of my own experiment. Well, why don't I try this? And my wife try it. And she immediately noticed that intermittent fasting became much easier for her. Didn't have any food cravings. For myself, as an athlete, I'm a competitive ultra runner. I noticed my recovery was significantly better. And so, I reached back out to Dr. Bickman and said, is it because I'm oxidizing more fat? What's going on with this? And he said, no, that Yerba Mate, the chlorogenic acid, actually helps the liver produce more glutathione, which is a master antioxidant. Makes the body go from a more oxidative to redox. It basically helps squash the inflammation. I'm like, well, I don't really care how this works. I'm just glad that it's working. But, we so desperately need tools. It's not easy to be a metabolically healthy human in our current society.
Yeah, and we're up against it. I think a lot of us, myself included, have had gut issues, right? Where we have our guts out of whack. And so with the balance, there's a lot of people coming out talking about how fiber can benefit us. Not fiber just because of constipation, but for feeding the gut microbiome. And I started diving in a little bit, and I was like, you've got to be kidding me. I just kept going down the rabbit hole of most obese people have a diminished short chain fatty acid. Where's 99% of your short chain fatty acids come from? Your gut microbiome. So if you're missing these guys and you're not taking care of them, now long term you're going to have some issues. So a lot of us are trying to replenish and fix this too. And then how do we get our hunger cravings and all that to get on the right track for a lot of people? So it's we're doing a lot to figure these things out.
Yeah, and so balance. So there's two products that Dr. Bickman really recommends: Mate, which is the Yerba Mate, and then the Balance, which is a fiber matrix. And I've been kind of Switzerland on fiber. I'm like, I don't know, is how important is it? Like you said,
I've swung like a pendulum back and forth, going, it's not
yeah,
important. You don't need it if you're not digesting those things. And then you go, what if they're doing other jobs? And then, you start, yeah.
and I found a lot of people at some point, if you have a super irritated gut, for some people, completely removing fiber can be really beneficial for a while. But I found people sometimes that are doing long-term carnivore or very low fiber diets actually benefit. Like you said, they don't have these short chain fatty acids, and they're super important in your gut microbiome. And so,
And for satiety and for your brain. And there's a lot that does in healing the gut lining. So there's a lot that it does that people don't talk about. That like more like it's not on people's radar because it's so foreign. But once you start seeing the benefits, I mean, I'm seeing LDLs drop like crazy. Even though in the low carb community they're saying, well, LDLs don't matter. But what's interesting is if you have these endotoxins leaking across your gut, LDL and HDL. HDL is the number one. I mean, it was shocking to me to see this because we know low HDL is a risk factor for dying of everything, right? But HDL is like if someone's septic, the HDL drops by 70% the first day if they're septic in the hospital. And then the LDL drops by 50% the second day. And you go, well, that's probably not the healthiest way to, but it's just showing that it's these guys scavenge all that garbage that's leaking across our gut and takes it to the liver to get detoxed. And you go, wow, maybe that's part of the reason we're seeing these big elevations of LDL in some people, not everyone, but some people who have a bad gut. And so, to look at it and go, okay, it's working. We may not know all the mechanisms, but you see this combination seems to work for a lot of people.
yeah, yeah, I've had a lot of people. And one of the nice things about the system, so the Unimate and the Balance together are called the Feel Good System. Is you get the chlorogenic acid, you get the energy, you get the increase in GLP-1, increase in fatty oxidation from the Unimate. And then with the Balance, like you said, you're feeding your short chain fatty acids. It's helping people reduce triglycerides, increase HDL, which is very difficult to do. And also, they have, a study that was done at the Cleveland Clinic showed it was more effective at lowering blood glucose than metformin. So it's, once again, all these incredible benefits without any negative.
That was from the balance part of it or both the combination?
Just balance. That was just
Yeah,
balance.
just balance. Wow.
So, so yeah, and so many people, like you said, if you're diabetic, pre-diabetic, the biggest thing we're trying to do is get your blood glucose down, is to get insulin down. So what tools can we use to make this long term and make this sustainable? And ideally we would we want to do that without prescription medication if we can. Certainly there's a place for that, in certain cases. But it's been really incredible to see people I'm working with, that are either on weight loss stalls or plateaus. And there's so many different uses for these two products. I've had people with migraines, I have people with rheumatoid arthritis. Like anytime you can get inflammation down and ketones up, you're doing good things.
Yeah, I think you attack every aspect of that because I'm convinced now that you can't be metabolically healthy unless your gut is right too. And then figure out. Yeah, and also if your brain's not right, it's hard to be, or if your body's not right. So it's all these things are communicating back and forth, saying we got a problem. Like, what can we do to fix some of these things? Like Ben Bickman, who we've already talked about, he's talking about make sure you get enough sleep, don't be stressed all the time, don't hate the world, exercise regularly, don't smoke or drink to excess, and eat real food. And you go, okay, that's like what I have control over. But sometimes we need things that can help us stay on track or get back on track, after the holidays or whatever.
Yeah, I mean, any tool we can have, I am all, like we were saying earlier, like it is incredibly difficult in our current society. People are working a ton, or there's all these kinds of family stress, financial stress. Every hospital I worked at had probably the most unhealthy break room food. You're exposed to all these things, so being able to have stable blood sugar, not have sugar cravings, have stable energy is going to help you potentially, make better decisions when it comes to nutrition.
Yeah, and how do you think that is from a dietitian standpoint? Like you look and you go, okay, what's the worst thing I could give someone if I want to kill them? It's like what they're giving in tube feeds right now. You're putting in seed oils and pure sugar and maltodextrin, all this stuff. You think, how can that possibly, especially if you're not even getting to enjoy the taste of it, right? That's why, Health Code sponsors my podcast, which Ben, when I go back and I'm looking at the formulation, I was like, holy cow, like stuff I'm learning now, like 4 years later or 5 years later, stuff that he put in there. It's like, yeah, acetic acid is important. This is important. This is important. And I look, I'm like, man, if I could put that feeding tube in people with Parkinson's, man, we could do so much better. But the hospitals just like, it's like these food companies just rule everything and no one questions again. Wait a minute, people don't get healthier. They get fatter maybe, but they're not putting on lean muscle mass, these things that we know improve survival.
Well, as a dietitian, we're taught calories. It doesn't matter where it's coming from. It can come from, steak and eggs, or it can come from, soy protein isolate. So I think that's where the disconnect is. It's like, oh, well, if it doesn't matter, you just look at these numbers, it has 2,000 calories, much protein. But of course, we know that's not true. It's our body doesn't have calorie receptors, right? It has hormone receptors. And, you're putting these highly inflammatory foods. That was one thing I asked in my internship. Is this the best way to feed somebody who's been in a traumatic accident, has had a major cancer where they can't eat? Personally, I had a personal client that was on a tube feed for a while for a GI issue, and we were titrating her off it. And her partner was just saying, like, she has all these stomach problems and sickness and nausea. Is there anything we can do? And I was like, probably not until we titrate off this. I mean, even the better formulas. And I mean, Kate Farms is a little less, there's some that are a little less terrible, but they still are just sugar. They have tons of sugar. And I've questioned, like, why could we come up with like a ketogenic tube feeding formula? Probably, but I can't imagine it would be profitable. That's the thing, is these.
It's the problem is that they're expensive because the products are expensive, but talking to people and you start realizing what's being done out in the community. Like Dr. Tidman, I don't know if you've come across her yet. She's treating she has some case studies and you look at it like, oh my goodness, she's the head of Parkinson's research in Colorado, and she's taken this guy that was on hospice, 32 years old with a severe Parkinson's, in bed, shaking, couldn't do anything. And he was on hospice, and she said, you could try 2 Ps. She gave him health code, MCT oil, all this stuff. The guy ends up going back to work. And you go, wow, how many people are like, and I mean, that's a miracle. Like in medicine, you don't see that. Like when she told me, I go, come on, you have this documented? She's like, it's published. I was like, holy cow. So you start seeing things like that and you go, wow, that gives us hope. And it's hard. As a matter of fact, by the time this comes out, I will have given my talk, but I'm giving a talk with some dietitians. They're like, well, you can't talk about that keto stuff, type thing, because that's going to kill people. I was like, here's the data. I mean, here's how many research studies you need to see. And it's hard because there's this mindset, that it's against the grain, really.
Yeah,
literally.
I understand, because I was there too, right? Like you don't know what you don't know. And when you go through schooling and you go through an internship, and where all they're teaching you is carbohydrates are essential for life. Your brain needs carbohydrates. Dietitians are the experts. If anyone else says anything, they're a bozo. Ketogenic diets are dangerous. Saturated fat is bad. Like, it's pounded into you. Like it's cult-like to some degree, because like you said, there's so much evidence. I remember when I lost my health and I started researching ketogenic diets, I was angry. I was amazed. It's like, how are there multiple?
Because you were doing what you're supposed to be doing, right? You're going, I'm following what they're telling me to do, and I'm getting sicker.
I'm eating tons of healthy whole grains, quote unquote. I'm eating tons of fruits and vegetables, lean protein, not a lot of fat, minimal sugar. And I was massively, anxious, depressed, not recovering from running. I was just a whole mess. Like, it was a metabolic mess. I couldn't go more than a few hours without eating. I would get like cold sweats. It was awful.
What do you think? I would love to hear your opinion on this, because one thing that just came up in the San Diego meeting, one group like Berta, Dr. Finney, they're saying, look, super high fat ketogenic diet is the better way to go for most people. Then we have the Emmerichs of the world. They're saying, look, lean protein, cut back on the fat. What do you think? There's one thing works for one person, another thing works for another person, or do you think it's like saying, let's change what we're doing all the time? What do you think is the best approach for someone who's metabolically sick and diabetic?
I mean, I think that's a great question, and I kind of go back to when I was in a new employee orientation time. I remember a woman saying, like, when somebody is sick, like they come in the hospital, they have, like, say, congestive heart failure, whatever. Nobody says, like, hey, I'm in a crisis, challenge me.
Yeah.
I don't want to make it too complicated. And I think that's one reason nutrition guidelines have failed because they're so arbitrary. It's like, eat this, it's all kind of a mess. And so I love Dr. Glantz approach. It's like, it's a 2-page handout. Eat this, don't eat this. And as far as like high protein versus high fat, I mean, if you are obese, if you have lots of excess body fat, you certainly don't need to be eating a ton of excess fat. But I also,
Yeah, yeah. I think that's a danger that I see. A lot of people go, "Well, I just eat fat all day." So, well, that's a lot of, even though we're not talking about calories necessarily, but you, the energy has to be stored somewhere in your body, right? It can't just be floating around the bloodstream.
yeah,
So it depends what we're storing. So I've seen people do. I have this one guy, and once we got him fasting, his sugars dramatically improved. But when he was doing like bulletproof coffee in the morning, his sugars would go crazy just with adding butter to his coffee, nothing else. And I'm like, why is your sugars going crazy in the morning? So he has nowhere to store that excess energy. So all the extra sugar his body's making is just floating around the bloodstream. It's like, oh, that's not good for you. But I've seen other people, they add more fat to their diet and their sugars improve dramatically because they're sensitive to the protein. Some people. So it's funny because I just don't know how people are going to respond until you kind of pull that lever and see, right?
you really don't. And in my overwhelming experience, people have a ton of body fat to lose. I like to lean them towards more protein, and if people, they don't, or, I work with a lot of women who unfortunately undereat. They're just eating a bunch of protein. It's like, oh, why do I feel so awful? It's like, well, you have to have, you can't just eat 100 calories of protein. You have to have fat. So I think it depends on where your metabolic health is too. Like, are you a very rare metabolically healthy human?
Yeah.
Are you super active like me? I certainly lean more into fat. Are you, certainly if you're obese or type 2 diabetic? But you're right. Like, and I think that's why things like CGM are so great. If somebody can have a CGM or they can check their blood sugars, they're able to get some feedback in real time, But yeah, I don't think there's just, and that's one good thing to think about. There isn't just one clear answer. So if you're somebody who's doing a super high fat diet and you're not getting results, then it likely makes sense that you pull back on the fat and potentially increase the protein.
Yeah, just change it. Like, if what you're doing is not working, pull a lever, see what happens. Pull a lever, see what happens, and be not being, this is what Sean Baker does, or this is what Paul Saladino does. Because I guarantee you, if you're a 350-pound diabetic and your sugars are 400, you're not Paul Saladino. Paul
No,
Saladino surfs 3 hours a day. And he's like under a red light half his life, and not exposed to chemicals. He lives in the jungle somewhere in Costa Rica, right? So like it varies where you're at, and it may change along the journey too. If you start out the 350-pound, now you're a 180-pound fit muscular person, you can change what you're doing. I don't think we have to be militant on what we're talking about necessarily.
and that's hard for people because a lot of times people will be like, man, my health got so much better eating this way. And now I'm either at a plateau or maybe starting to feel worse. So being open to growing, learning, evolving, changing is very important.
Yeah, and that's one thing I was really impressed by, because I thought, oh, when I gave this talk in San Diego, I thought, oh, the people like carnivores are going to come unglued, because I was saying, look, there's people who have initial benefit. I'm following them chronically, and then all of a sudden their triglycerides, insulin, everything starts going up the wrong way. I'm like, how can this be if they're eating zero? And it bugged me because I'm like, how can this? They're eating zero carbs, and if carbs are the whole problem, they should all be getting healthier and healthier. And then I had a couple of people, I said, let's just add in a little tiny bit of this inulin fiber, and let's try adding in a little of this. And all of a sudden, boom, everything got better and they felt great. And it's like, I just saw a guy yesterday and he's like, he's the best he's been in 30 years. His seizures are gone, right? But part of it was just adding a little bit of fiber because it helped him initially, but it wasn't working anymore. So I think that's the next frontier we have to look at and say, okay, how is this, with the balance and the Unimati, what is that something that's going to help people? Like, what I'm saying is, just because you can do something doesn't mean it's a good idea. So riding 100 miles at a time, even though you can do it and you can push yourself, but there's some damage that's done, as you know, as a long
Yeah.
distance runner. So there, at some point we get diminishing returns on what we're doing. We have to be open. But the thing that was impressed me on the conference, I had 5 carnivores come to me and go, that's exactly what's happening to me. Can you come talk on my podcast? And they're carnivores, and they go, we're open to hearing what's going to help people, and that's the important thing.
Yes. And I love that because, there's likely a period, I did full carnivore diet for a while where you're like, maybe your gut needs a rest, needs a reset. But
Totally. Yeah, absolutely. It changes the gut microbiome in a positive way initially, for sure. There's no question about that. Firmicutes goes down, like all these things that we want to go the right way does, and you're taking all the processed food and sugar out, right?
yes, 100%. But then, like you said, it sometimes I think we don't ask what's next, and then, or just being like, okay, make some changes, and carnivore, historical carnivore was probably very different than like our current carnivore, where throughout history, people were probably eating more like scavenged meat and fur and all this weird stuff, where now it's like, sterile and clean. And so I very appreciate what you're saying, like being open to changing and to learn, growing, because it's not like there's no gold medals for being zero carb or eating carnivore. The goal is to be as metabolically healthy as possible.
Yeah, and once you achieve that, then you get away with stuff like other people can, right? So I haven't achieved that yet, unfortunately. But once you get there, you go, okay, that's the benefit. There's upfront pain of figuring this out and saying, look, you have to I tell people, look, you can get away with a lot of stuff. I'm seeing what your metabolic system looks like, but there's other people who are really sick. Like you can't, like if all your storage units are full, you can't go shopping at the garage sale. There's nowhere to put stuff. You have nowhere to put this extra sugar you're taking in. You got to fix that problem first, and it could be gut related. It could be stress. Stress is another factor, that we're seeing a huge, that has huge impacts on continuous glucose monitors. Like you have a stress day, even if you're eating zero carbs and your sugars go crazy, cortisol, stress hormones. And I think that's what a lot of athletes are dealing with. The people that you're running against, are struggling with this.
Yeah, what's really interesting is I worked with a gentleman who he was telling me like zero carb, but he was pre-diabetic. And I'd never seen that before. And so I said, my first intuition is like, are you sure you're zero carb? Like,
Exactly. That's it. It's like my carnivore is the same thing. I'm like, are you sure you're this strict as you say? All
but
I have is eggs and butter and meat. That's it. Nothing else. And you go,
yeah,
okay.
he was
All right.
a firefighter. And so wearing a continuous glucose monitor, you could literally see a huge spike in his blood glucose when the alarms would go off. And then he's, like, it was so interesting to me because
Mm-hmm.
stress, in people, you can see so many, like, they have an argument, you can see small spikes in blood sugar, but it was incredible to see these huge rises. I mean, but that's what happens with, cortisol and epinephrine, right? It was designed to increase your blood glucose to get you out of that dangerous situation. But now, for someone like him that has a very stressful job, it was like, okay, how are we going to try to bring that down, from either breathing techniques or other things? But that was just something outside of diet. Because sometimes I think we get really, and I know I do as a dietitian, get pigeonholed into like, it's just diet that causes blood sugar to rise, where it's like, oh, there's a lot of things,
Yes, sleep deprivation. As a matter of fact, crazy enough, you were there, but we're on the low carb cruise. I'm gonna give my talk. 4 minutes before I go on, I get a text from my brother, panicked, from the doctor. Like my mom was going on hospice and she was having. And right before I go up there, I was like, I couldn't even breathe when I got up there. I was like, holy cow. And my sugar, I went and looked at my CGM that I had on. It went from 68 to 172, like that straight up. I was fasting. I didn't eat anything, but that stress response of saying, oh, I can't, let me finish this talk first and I'll call you right as soon as I'm done. And so, yeah, that stress response was unreal. I had never seen that on myself. I've seen it to some degree, but that was the combination of going up to speak and then like having bad news that you got to take care of and stress. It just shows you people are in that chronic stress state all the time, how much of an impact. And it's a cycle too. Like we talked about it. If you're stressed, you're not going to be sleeping well. And if you're not sleeping well, you get more stress. And then you want to eat stuff that's bad for you because you're trying to calm your system down. And I knew that during residency, is like being up all night in the ICU. The next day, everyone was eating everything. Even my fit people that I worked with were eating everything. Everyone was starving, high carb. Everyone was leaning towards that way. And now we have data showing, yeah, sleep deprivation specifically makes you want to eat more carbs in processed food and sugar.
Yeah, and we see that, and it's a hard cycle to break because, like you said, it kind of snowballs down a difficult path.
Yeah, and once you're there, it's hard because if you're, and that's one of the things we're seeing. And Jason and Fung and I talked about it too. It's like no one's getting a massage in the middle of their massage saying, "Look, I got to eat something. I need something to eat." Like you're relaxed and you're in a good state. So I think that's what we were seeing is a lot of people when you're eating processed food and sugar, your hormones, insulin, everything's all over the place, up and down and crazy. And then once that balances out, you go, yeah, I really don't like. I skipped lunch yesterday; it was no big deal. But that emotional, there's so much, and I would love to pick your brain, like, and we don't have to talk about details or anything, but like where for the eating disorder stuff, where did you have a breakthrough that you said, oh, okay, like I can control this and not be stuck in worrying about your weight all the time or whatever? Or is it always a problem that you just kind of minimize?
Yeah, I think for most of my life, I really was just a high functioning person with the disorder. I like the standard diet. I was an athlete up in my 20s and 30s, and then it wasn't until like I was trying to qualify for the Olympic trials in 2019, and it just kind of felt like my health fell off a cliff that I decided I wasn't going to run anymore. And then since I wasn't going to run anymore, I might as well do a low diet because I intuitively knew carbohydrates didn't make me feel well. But once again, I'd been told my whole life, you have to have this, you have to have this. And it just felt like everything got better. Like my brain healed, my anxiety healed, like my whole world changed when I was fueling off fats and ketones. And that is probably the first time in my life that I stopped really worrying and obsessing. And, I actually ended up gaining some weight. It's wild because I'm still like a pretty lean human, but that 10 to 15 pounds heavier than I was 6 years ago. And now I compete in, again, training. But I think for so many people with eating disorders, I would imagine it's similar to like bipolar disorder, schizophrenia. You just don't metabolize glucose as well in the brain, and we're taught to eat all these carbohydrates and these sugars, and you're on this blood sugar roller coaster, which just that in itself, is can cause anxiety. And so for me, being able to fuel my brain on a different substrate, like it's changed everything. Like I don't weigh myself, and I do that. I always tell people with the eating disorders, people I've worked with, like, you got to protect your recovery, just like, an alcoholic would protect the recovery. Like, there are things that I'll probably always struggle with. Like, I don't think the number on the scale will ever be right. So I'd rather not know. I've been in a state.
Yeah, and that's a good point. Is that if it bothers you, sometimes you need that for accountability. Those of us who can gain, go, oh, I'm eating terrible food. And I haven't gained weight in 3 weeks, and all of a sudden, a month later, you're like, oh my gosh, I gained 40 pounds. Like it's wild. So for some of us, but I agree. I have people that weigh themselves 6 times a day. It's like, relax. The stress of that is going to make you not lose weight just from the stress of that. Of every time you get on the scale getting fresh, because you're not going to lose 12 pounds in a day. It's not going to happen.
Exactly. And to me, it's so like arbitrary. Like my health has nothing to do, as long as you're a normal BMI, metabolically healthy, like whether I'm 5 pounds heavier or lighter, like that doesn't change. It's just going to mess with my head. I think a lot of people with eating disorders could probably relate. So yeah, it's just, and it's so challenging. I was talking with, my wife, we were just saying like eating disorders and addictions are some of the hardest populations to work with because it definitely like it can suck you back very quickly. And so for me, I have a routine that I know pretty much what I need to eat, but being able to be flexible with that is also something that's great because when you're really sick, you're very regimented. Like everything has to be measured and perfect and controlled. And I don't live my life like that anymore. So I'm very grateful.
Yes, an amazing thing because I remember when I interviewed Zach Bitter, he cycles his carbs in and out, but he'll train fasted a lot of times. And just talking to him, I'm like, let me understand this. You're in the middle of the season, you're 145 pounds, and you go keto. Like, why? Why would you even think about that when you're so fit and healthy? He said, I was inflamed and I was injured all the time, and it took me forever to recover. He said, once I started eating clean, all of a sudden, boom, I could get up and jog the next day after I run 100 miles one day, and I get up and go for a jog the next day without being in pain and miserable and suffering. And I go, okay, it makes sense now. And then he realized he could tap into it, and so he was a guy who helped me just mentally because when I started low carb, I'm like, oh, can I fast all day? And can I and I'm like, okay, Zach Bitter's running like 100 miles pretty much fasting, so I could probably get through my work day, And so when you start thinking in those terms, and another one that's one of my patients is really fascinating to me. I was looking at his old history, and he would gain a bunch of weight in the summer and lose a bunch of the weight in the winter. I said, this is so weird. Like when I first met him, I was like, no one does that. Everyone gains weight in the winter when they're lazy and they have Christmas and they're eating worse. He goes, no. He goes, I gain weight in the summer because I ride my bike a lot in the summer. I'm like, shouldn't you be losing weight if you're riding your bike? Like he goes on long bike rides. He goes, well, I carb load for my bike rides. And when I stop exercising, I cut out my carbs in the winter time because I'm afraid to gain weight in the winter, and he loses weight in the winter. And I was like, this is great. So he was carb loading way over what he needed. And over time, we got his insulin down, we got him healthy, and then he went on a hard bike ride, and all of his friends they would carb load the entire ride, like drinking everything. And I go, just try it one time without it. And he did it without it. His sugar shot up crazy amounts when he was doing the big hills because his body was taking care of him and releasing all that extra sugar for him to burn. He didn't have to be eating it all. And now he's super fit and healthy. And it was just amazing how his mind changed. He goes, I don't need all those carbs to exercise. But, like what you're saying, being long distance runner, it's just ingrained into you that that's what you have to do. And then that keeps you from running on your coal or fat stores to go these long distances.
Yeah, it's wild how many people with marathon runners that actually gain weight when training for a marathon. it seems so counterintuitive, because if it was just calories
It's
out, it's like you're running 50 miles a week. How in the world are you gaining insulin? People are taking in so many carbohydrates before they run. So, okay, now I've suppressed fatty acid oxidation and I'm taking in all this fuel. Okay, well, during the run, I'm taking in carbs. So I'm not burning my own, I'm not burning fat. After, yeah, I'm eating carbohydrates. And so training your body and saying that you can't use carbohydrates strategically. I know that, I do that, but being able to oxidize as much fat for fuel as possible is what we're really going for. I would second what Zach says. Like, my running recovery is, and that's what you have to have a successful long distance athlete, is you have to, it's not just doing it one day, you have to be able to do it day after day after day. And so by being able to oxidize fat, constantly pulling from your muscle and liver glycogen, I mean, I found my recovery is just off the charts.
Yeah, it's crazy. I interviewed Mark Sisson not too long ago, and I was blown away. He said, "Brian, that we keep tracks of all this stuff. What's the average weight loss in someone training for a marathon?" And I was like, "Probably 9 pounds or so." And he goes, "No, plus I think it was plus 6 or 8 pounds. They gain weight." I'm like, "Really? How can that be?" And you're running like couch potatoes who are now running. How can that possibly be? And he goes, "It's because that demand you put on your body, you get that much hungry. Plus, you go, I just ran 12 miles. I can eat whatever I want, and you out eat what you actually burned." And you go, "Wow, that's pretty wild." It is pretty wild to think about.
No, it truly is. It's because you would think, like, you exercise that much, you're going to, no matter what, and the body changes. How a metabolically healthy 20-year-old running is going to be very different than like 30s or 40s, certainly older than that. So yeah, and there's that mentality, like, okay, if I've run, then I get to eat a huge plate of pasta or whatever, and that's just not metabolically how the body works.
Yeah, and I think that's the big thing is for all of us, like staying metabolically healthy is the key. You get away with way more if you're metabolically healthy than someone who's metabolically sick trying to fix that, trying to reverse it and to be healthy now. It's just so much more challenging. It's just like anything. If you have Parkinson's, it's easier to prevent it than to treat it.
Oh, 1,000,000%. And that, I mean, that should be all of the medical system, right? Like, how do we keep people as healthy as possible? Because once you become sick, then it's amazing how expensive and painful and all those things it can be. But once again, that's just a societal thing. Is it's like, oh, it'll never happen to me. Oh, I deserve to eat this and that, and we're starting out with bad information from dietitians, and most doctors have no nutrition information at all. And then people have the attitude that I can do whatever I want, I deserve this, and it's a recipe for disaster.
Yeah, and that's the other, and I think that's a great point you bring up too, that you deserve it. So the other thing that happens, a lot of us say, Monday through Friday, I do so well with my diet. I deserve to go out and have it like whatever I want, go to happy hour Friday night and go and do all this stuff on the weekend, and then I'll get back on Monday. I think that's such a common thing for a lot of us.
Yeah, even my type 2 I work with, it's funny. They'll say, "Oh, I had a cheat meal," and I have to be like, "Hey, your whole life, unfortunately, your A1C is 10. We don't cheat meals. We don't cheat days." Like, it's so interesting because it's literally, nobody would, or I would hope nobody would be like, "Yeah, I think I want someone to take a baseball bat and hit me as hard as they can on Saturday and Sunday." It's like, you would never do that, but that we do that with nutrition. Like, oh, we're just gonna massively inflame ourselves or hurt ourselves. So I try to reframe that type of thinking. Because I have patients that just say, "God, I just can't wrap my head around giving up sugar or bread or cake forever." And I was like, "Oh, well, you're an adult. You can eat whatever you want whenever you want. I can too." But your health
Yeah.
is so valuable. Or what is it to you? What goal? You have kids, you have grandkids.
Yeah, that is so critically important. I'm glad you brought that up too. And I had a patient, she killed it, but when I first met her the first time, she's multimillionaire. She owns a bunch of wineries and so the first time she's in my office and her coworker was like, "I'm in. You tell me to eat glass, I'll eat whatever you want me to do." And she's like, and this lady was like, "Doc, look, is it a deal breaker for you if every once in a while I have a piece of bread or have that? Would that be exclusionary of having me follow you as a patient?" I go, "No, but why are you asking to cheat on me on our first date? We haven't even started dating yet. And you want to cheat on me already, right?" And she goes, "Well, I'm just saying things may come up because I have to taste stuff that my chef is making for the new." It's like, okay, great. And so after 2 weeks, she comes back in. I have a continuous glucose monitor. I'm looking at it going, "Oh my gosh, this is not going to work." So I sat down with her going, "Look, doing what you're doing is not going to work." And she said, "Why do you say that?" And I go, "Look at all these. What's OT mean? Every time you have OT and then your sugars go crazy." She goes, "That's Orange Theory. That's my workout." And she goes, "I haven't cheated once." And I go, why did you have that attitude? Like I'm curious is why was that your mindset? She goes, I've done Whole30, I've done, like liquid diets. I've done it all for 30 days, but then day 31, I go crazy because I've denied myself of all this stuff. And I go, well, why aren't you eating those things now? She goes, I just look at everything and say, is it worth it or not? She goes, not worth it, not worth it, not worth it. She goes, nothing is worth it. I want to be healthier. And so for her to decide that, because if you take it away from her, all she does is want it. She goes, if I can have it if I want, but I decide not to, it's different than you telling me I can't do it.
How you frame things and your perception of it will make you successful or not. Because yeah, if you come from that deprivation, and that's what so many diets are, right? It's like
Mm-hmm.
all the like low calorie, low fat, slim fast, all these diets. It's like if I can just muscle through those 30 days or 90 days and lose the weight, then I can treat myself. Then I can go back to eating. Where it's like if you can set yourself up to I'm eating in a way that I enjoy, that's sustainable, that that I don't feel deprived, and you mentally say like, yeah, I get to have whatever I want whenever I want, but I choose not to. I'm a pretty lean person. I've been very fortunate. I've never dealt with obesity or type 2 diabetes. But when I eat a lot of processed foods or sugary foods, it's very bad for my mental health. I struggle with anxiety. And so for me, that's my that's my why. Like, hey, I want to be a mentally healthy person. So when you have that in the back of your head, it never becomes deprivation, and it never becomes I can't do this. Yeah, because I'm an adult. We
Yeah.
anyone telling you, but it becomes that my desire to achieve my goals and be healthy is so powerful that it overrides that.
And that's such an important point too, because so many of us think, oh, if I could only have like on my birthday, I'm gonna have a Twinkie. That's my favorite, whatever. And then people have it and they go, it wasn't even that good. And it tasted terrible. And like they see it for what it is now because they go, I know it's not good for me and I'm still eating. I didn't even enjoy it. So sometimes that cheat meal or whatever, they feel terrible for 2 or 3 days. I'm like, I'm glad you did that. Because now like I was feeling so good. And that's how you felt all the time. That was normal for you, how you're feeling after eating all that terrible stuff. Just like if you drink too much one day, you go, oh, I'm not doing that again, right? So sometimes that helps people to take the fantasy out of this. I was waiting all year for my birthday so I could have this one thing, and they eat it. And they go, it wasn't even that good. I didn't even enjoy it. I'd rather have a steak. I feel
Yeah.
healthier and better, right?
Often people don't even know how bad they feel. Like, they're in this chronic, inflamed, terrible energy state. And so they start to feel better, like, oh wow, this is amazing. But you still have, like you said, that like, oh, I can't wait for my cake or this whatever thing they're gonna have. And then they have that and they feel terrible, which like, it's good feedback. It's like you said, it was like, well, I don't want to do that again. That's
Well, in this perspective, I remember on Low Carb MD, I think it was episode 13, we had Rob Sivers on, who's like hardcore that sugar's addictive, right? And it's not a food. And he goes, look, it's not one of the food groups and all this stuff because it's addictive. It's like alcohol is not a food group. And so, anyways, he goes, Brian, just imagine what's your favorite donut? I go, I don't know, glaze. I haven't had one in a few years. He goes, okay, so you had a glazed donut and you were so excited to have this. You've been waiting and you can't wait. And then someone walks by, you're about to take a bite, someone hits your arm and it falls in that pile of dog. He says a different word, but dog poop. And would you pick it up and eat it? Of course not. You see it for what it is. And I think once you start seeing stuff, it's like when I was eating that way, I was depressed, anxious, felt terrible, hated the world. And you go, I'm enjoying life now. Why do I want to go back there? Like if you get off drugs, you don't go back and say, I want to like grovel in the streets trying to find a marijuana butt on the ground or something.
and it's so temporary. Like I think you made a point. Like people, and I know I've done this before, and you build it up in your head. It's like, oh, it's gonna be this amazing, crazy, wonderful experience, and it's like, what, you eat a donut, it takes 3 minutes. It's like, okay, I kind of should high dopamine rush for 3 minutes, and now I have the whole day to feel anxious and miserable. Like you start to see the trade off, and when you build a life that's better than food, like so many of us are controlled by food because we're eating so many carbohydrates all the time. You have these blood sugar spikes and crashes, or you have challenges in your life that your people use food to cope. So being able to heal and step outside that, in my experience, is you start to not desire to go back down that way.
Yeah, it's so huge. And what you're doing is so important. It's so hard to step out and say, I'm seeing it different. So now if you're with other dietitians, are you better received now? Do people like from 5 years ago, do you think there's a turning of the tide where people saying, maybe there's some sense of what you're saying? Let me look into this, or is it still like, no, that's not the guideline?
And it ebbs and flows. I would definitely say now it's better than it was, 5, 6 years ago. When I started in 2019, like I got a lot more angry dietitians and, hateful messages and, oh, you're causing eating disorders with low carbohydrate nutrition. But I do think since we're hearing more about it, there's more exposure, there's more messaging around it, I definitely personally have experienced less resistance. I mean, you're still going to experience that professionally. Most hospitals, settings, you can't practice this because it's not the standard of care. But I'm hopeful with the trajectory of at least getting the information out there. As far as like, are we going to see policy changes? I don't know. But I always tell people like we don't need the government guidelines or regulations for you to personally change, for you to change yourself, your community.
Well, and that's the thing. That's the thing that's so amazing to me. The more people I talk to, they go, "The guidelines suck. We hate the guidelines. We don't follow the guidelines." Like, why do we have them then? Right? A lot of people, but the problem is now we have the schools who think this is a healthy way to eat. Now you got all the nursing homes and you got the prisons, and
That's
you know,
why
and you go, oh,
it changed
gosh.
guidelines. But I just, every single member of Congress, I mean, Nina Teicholz told me this, is sponsored by at least one pharmaceutical. I mean, we have some people that are sponsored by dozens. So it's like, are you going to pass a bill or a change in policy that's going to upset your sponsors?
Of course, and that's what I mean. These governing bodies who are making these decisions for their like, if you're the American Diabetes Society, you have a responsibility to your patients, the people who are following you, and say, "Hey, look, give me the best available advice, whether it goes against everything. If I get better, I don't care." But I've always looked at it as like, okay, that patient in front of me is what matters, not what everyone else in the world is doing, right? Ultimately, you say, okay, what's going to work for that patient? What's going to, you know, get them healthier? And for us, I mean, when we look at the data, it's overwhelming that the processed food's an issue, and it's overwhelming that insulin resistance is the issue there's the underpinning of all the diseases I'm treating. So you
Yeah.
go, if we don't fix that problem, we just focus on LDL cholesterol and forget all this stuff. That's like, when you look at the risk factors from the Women's Health Initiative, I mean, it's so clear when you look at the study. When I show people studies, they're like scratching their, like, what the hell are we doing? Like, common people can look at that in a 3 minute of my talk and go, what are we doing? This is crazy. How come we're not focused on the high insulin? That's the biggest issue across the board.
Yeah, my 6-year-old can look at a graph and it shows like what foods cause rise in blood sugar and be like, protein is very small, fat's negligible, and carbohydrates are a mountain. She can look at that and be like, that's the one we should lower for.
Well, even if you did that, right? Even if you did that, if you took a continuous glucose monitor from one of us and you take a continuous glucose monitor for someone eating the ADA's recommended diet and blind it and go, okay, which diet do you think is better? They would look at that and go, oh, no question, this one's better. And then they would not be happy when they found out the unblinding of what happened, of who is doing better. We see what's doing better because we have the CGMs, and a lot of people argue against the continuous glucose monitor because they go, yeah, people don't need to know that. Guess what? As a matter of fact, one of my good friends is Italian, and he goes, Doc, I'll just die younger. I go, look, you got grandkids, you got like people that love you, and you're a great guy. It's like, you should think about this again. You're gonna you're willing to give up years of life and seeing your granddaughters graduate from high school and all these things. And so he goes, yeah, I'm just gonna. I enjoy Italian food. What do you want me to do? So, anyways, I put a CGM on him, and in January, I look at his numbers, the best ever. I was like, "What happened? Your sugars are unbelievable. I mean, your numbers are fantastic." He goes, "That stupid machine you put on me." He
Yeah,
goes, I couldn't take it. I was
yeah.
looking at I would have certain foods, and I would see my sugar go to 400 like that, and then come back straight down low, and I was starving and hungry. And he goes, "When I cut that out, I feel so much better." I'm like, "Okay, and you'll live longer too, and feel better."
People, those are really powerful devices. Like feedback in real time. There's no
No comparison to that.
yeah,
Yeah.
that's what I was looking for. And I've even had type 2 diabetics that I've worked with that have the CGMs tell me that they didn't feel necessarily terrible. One woman was like, I didn't really feel bad, but when she could see on the CGM like just how high it was going and coming back down, she's like, I had no idea it was going to 300. Like, and I think she's just been in the state for so long.
Hmm.
See it, you're like, oh my God, I need to stop doing that. But if you're just, oh, maybe I feel a little dizzy, nauseous, whatever. But yeah, I would love I mean, can you imagine if it's like, hey, you're diagnosed with type 2 diabetes. We're going to give you low carb education. You're going to have a CGM. You're going to check in. Like, how different would those outcomes be if everybody?
It's totally different. Even without any guidance from us, you can see it. And then having an expert like us who look at these things go, look, your sugar went up when you were sprinting. That's perfect. Your body's doing what it's supposed to do. It's not bad. That's a good thing. So there's always these arguments, and well, people don't understand it. We'll have someone who can explain it to them then that understands what it. You didn't sleep well last night. Look at your sugars. Oh my gosh, maybe I need to focus on sleep. Maybe I know. I have people that it's just hilarious. I go, what happened on Tuesday at 3 o'clock? Tuesday, I was fasting. I didn't eat anything at Tuesday. I mean, you look at your sugars; they were crazy. was like, oh, my husband and I got into an argument because I took all my dad's stuff and I put it in our garage, and my husband didn't. So we got into an argument. I go, look at that. Look at that. You might as well eat a donut. Your sugars went higher than a donut with stress, right? And so once we start looking at all these different factors of stress and saying, okay, how, and that's what I love about what your approach is too. Like, what tools can help me? If Yerba Mate helps me get on track, great. If it helps those hunger cravings and all these crazy things, because I think we're you know, I would love to hear your take on it, but I think we're on the verge of a major problem with the amount of GLP-1s that are out there. And I talk to people all the time and they say, well, my doctor said I could just do whatever I want and I could just shoot this and I could eat and I don't have to exercise and I'll lose weight. And you go, oh, this is going to be a bad outcome for you.
Yeah, isn't it wild? I was thinking the other, if you had said like 2 years ago, like, I'm going to, if you're overweight, I'm going to give you an injection. You're going to do it for yourself of Gila monster venom, and it's going to potentially cause stomach paralysis, but you'll lose weight. People have been like, that's the craziest shit ever. No one would do that. And no, it's Eli Lilly is going to become the first $1 trillion industry. And I'm not anti, there's times when we need medications. These were supposed to be very specifically for very dangerous, intense type 2 diabetic cases, short term, highly monitored. And what it's become is just anybody and everybody. I feel like everybody I see now is on these medications, and there's no free lunch. There are consequences. I'm sure Dr. Bickman, when he talked to you, I mean, we're seeing bone and muscle loss. We're seeing fat redistribution, meaning like people are gaining more fat cells, and they're gaining, once you
and losing muscle mass. And these progenitor cells that would be muscle converted to fat cells, now you can oxidize it better, so you lose weight. But the problem is when you go back to your old ways or you come off the drug, all those fat cells are going to fill up. Now you have, instead of having 3 storage units, now you have 300 storage units, and you fill all those up. Guess what? You're not going to be able to walk.
You're not going to get muscle. You think you're getting back that muscle and bone. And Dr. Filippo Vadio was telling me they just came out with a study that it's heart cell size. Like, that seems like a problem. Suppressing ghrelin. You need ghrelin for autophagy, for cellular turnover. So it's like all the, suppressing insulin-like growth factor. There's all these downturn things that I feel like we're doing insulin.
Well, the big one too is blindness coming out, which is non-reversible. They call it AI-on, and it's 1,800 cases just in LA alone. And you go, irreversible, nothing you can do. Once you start getting it, you're done. That's it. You're going to go blind. You go, okay, you're never going to see your results. That's not good.
Well, and stomach, some of those issues with, you're slowing down GI motility. I've some people that come off the drugs, that doesn't come back. You have food just sitting in your stomach. You're severely nauseous, vomiting. Like, once again, we are, as a society, if we can just say, like, let me, there's nothing good in my opinion that ever comes out of the quick fix. It's like, why do people win the lottery and go bankrupt? You need to have time.
Yeah.
All day. Like, that's one of my favorite things about distance running. You put in the work every day to get where you're at. For if you want to lose weight, you want to have a fitness journey, you're going to have to put in this work. You cannot have shortcuts. You have a shortcut, it's it's not going to end well. And so I think like I said, we're going to see in 3 to 5 years massive issues. I mean, they're even talking about thyroid cancers and all these other things. So once again, my be very similar to Dr. Bickman, prioritize protein, don't fear fats, sleep, stress, can do good with those things. Get some.
Yeah, we have a big issue. And the other thing that I strongly believe in, I've always believed, is informed consent. Go, look, here's the risk, here's the benefit of anything we do. So when I talk to people about risks and benefits, I would say 90% of people will say, yeah, I'm not doing it. But there's so many doctors, and when I see patients who are on it having bad effects, and I'll say, well, what did they tell you? They said, just shoot this and you lose weight.
Yep.
They're not saying all the possibility downside. Any drug I give you, any intervention, including keto, I go, here's the possible downsides. Long-term, we don't have long-term data on some of these things. That's the truth, right? We don't know, like, having high LDL cholesterol of 900 forever, is that going to be a problem or not? Here's the data so far. Here's what we see. Here's the concern. Right? And so there's so much of that we do that we have to, and it's crazy. I mean, as a matter of fact, the informed consent thing, Tro was talking about it. With a 9-year-old, you can give them these drugs and it's no big deal. And like, you're going to shoot a 9-year-old for the rest of their life on these drugs without knowing long-term outcomes is a total disaster waiting to happen. And then, but if they go on a keto diet, then you have to do all this crazy hoops you have to jump through to be on a just to cut out processed food and sugar? Seriously? Like, where are governing bodies? How can they possibly have these recommendations where you go, this is insane? You have to check your, it was something crazy. You had to check your lipids every month or something. You're like, oh my gosh, like this is crazy.
Well, it's, it's just understanding and realizing that our healthcare system and nutrition system is not designed to keep you sick. And so they're going to make it more difficult to be a healthy human. And so you really, as a consumer, and I'm like you, I'm about personal sovereignty. If somebody says like, no, I understand all the risk, this is what I want to do, like, that's fine. But I'm experiencing the same thing where I'm talking to people about like, did your doctor talk to you about muscle and bone loss, about gastroparesis, about a 200% increase in suicidal ideation, anxiety, and depression after
Yeah. Yeah.
they're
Yeah.
like,
That's the other.
oh,
Yep.
they just said this will help me not lose weight and not be, or I'm sorry, lose weight and not be hungry. And it's like, that to me, that feels unethical. I have dietitians tell me you're unethical for recommending low carb, but it's like, so
Well, and it's one of those darn things, and I get it because all these drugs that work, like there's a couple drugs that make you pee out more sugar. There's so many diabetes drugs in there. Everyone jumps on board really quickly, and they go, "Oh my gosh, look, it decreases cardiac risk. It raises LDL cholesterol." Cardiologist, but you don't care about that because insulin is the risk. So if you fix that, it does decrease your risk, right? Even if your LDL goes, that's the point. And they go, well, that's just we don't know why that happens. Well, we do. We have the mechanism. We understand this, So that's the hard thing is that once something jumps on the and it goes back to your point when who's educating all the doctors pharma, and they're gonna not say, oh yeah, by the way, you could go blind, you could have like they go, oh yeah, that's anyone listen. If you don't believe me, listen to the commercials on TV. They're all singing and dancing because they're shooting this drug, whatever it is, and happy, and the great songs playing. And then at the end, they go, "Oh, by the way, it can cause blindness and diarrhea. And you can lose your eyes." And it's super quick because they don't want you to draw attention to that part of it.
they're just trying not to get sued. So I mean, they wouldn't even say it if they're. But yeah.
Yeah, they have to for accountability and everything. So, hey, Michelle, what's life's best medicine for you as a dietitian, as someone who's a crazy long distance runner and athlete, and encouraging so many people? Like, where do you go when things are hard? What do you lean on for your strength?
Yeah, I think, and we talked about it quite a bit today, is in mindset. Mindset is everything to me. That's something I've been really actively working on for the last couple of years. I'm a person of faith, but just reframing, staying really positive. And I'm so blessed. I have a great wife that's super supportive of my running, my nutrition journey, my life journey. But yeah, I mean, for me, it's meditation, it's reframing, it's visualization, it's prayer. And certainly I'm a fan of the low carb diet as well.
Yeah, and awesome, and all those things too lower those stress hormones and cortisol and insulin and all that stuff. And that's something I think more of us have to be in touch with is prayer, meditation. Hey, what's good in life? What are the good things? Because we can get so focused on the negative. As a matter of fact, my daughter just started a new job and she's focused on all the negative. I go, what are the good things? You don't have an hour drive anymore each way. This, and when she started looking at that, she's like, oh yeah, you're right. There's a lot of benefits, right? So in a partner, whatever it is, you start looking and going, if you focus on the bad all the time in your life, if you focus on all the bad, you're going to go when you go eat cookies and everything like that. If you go, hey, I have it pretty good. I feel pretty good. I don't need that to survive. And then seeing people like freed of that, being hostage of that, like food thoughts all the time. And I have to eat every hour. And what am I having for lunch after I'm eating breakfast? And, I've seen that so many times when people say, I feel free for the first time in my life. And you're taking those chains off. And so what you've been through and the amount of people you can help through your journey of all the hard stuff you've been through. So you go, yeah, I've been there. And that reminds me of, I heard a guy, he's in AA and he's in some, he's had struggles with alcohol and drugs. And he was making the point that you're stuck in this pit and the rich guy walks by and goes, hey, here's $500. Well, I'm in a pit. That doesn't help me. And someone goes, I'll pray for you. I'll do this. So no one, and he goes, finally, this homeless looking guy jumps down in the pit with me. And he's like, what are you doing? He goes, I've been there. I know how to get out.
Hmm.
Right. So when we go through those hard times, you can help that person struggling with eating disorders go, yeah, I've been in the pit.
Yeah.
I know what it's like down there. Like, here's the way out, not shooting another drug and all these different things. And so, and like we're saying, I'm not anti-med. I have a prescription pad and I do send prescriptions in, right? So you say, but how do we get that good balance? If I can add in Yerba Mate instead of shooting you with something that has all these side effects, then I go, okay, let's look at that tool. If it doesn't work, then we move on to the next thing.
1,000,000%.
And it tastes good, by the way. Thanks for sending me some.
You're welcome.
It's good. Yeah. I have my morning coffee and then my Yerba Mate. It's hard for me to get 2 down a day though, believe it or not.
Yeah. Well, one or two, like it's interesting, depending to how caffeine sensitive you are. But I found it actually, one for me is plenty. Some people do. Some people even do three. That's
Yeah, they're on that. Like I'm doing 3. Like if 2's good, I'm doing 3. I'm doing 5. So, but it's awesome. So thanks for that tool, and everyone. I'm going to put a link to that. And Michelle, how do people track you down if they want your help and guidance?
Yeah. So my website, thedietitiansdilemma.net. If you would like to work with me, you can send me an email through that site. I'm also on social media at Run, Eat, Meet, Repeat on Instagram, Michelle Hurn RD on X, and on Facebook just as Michelle Hurn.
Yeah, and that dietitian's dilemma, like that was stepping out into it, right? You wrote that. What year did you write that?
At 2021.
Yeah, 20. So that's 2 years into your journey, and you go, look, and then stepping on everyone's toes and go, look, here's how I see it. And it's amazing because it takes so much courage to do that.
Yeah.
So, everyone grab that book, is worth looking at. So how do you say everything I've been taught is wrong and I got to reassess? A lot of us had to go through that journey of saying, why are we like, it doesn't make sense what we're doing. And those of us who question, like, I'm not a question authority type guy. I go, okay, if that's the way that most doctors are rule followers, but at some point you go, why is this rule here? It doesn't make sense. Why do we have everyone on a sliding scale insulin? Then you're giving them a bunch of carbs, then you're shooting them with insulin to get rid of they were on insulin before they came to the hospital. Like, why are we doing that? That's just the way it's done. Well, that's not a very good answer. That's not a very good answer. So sometimes we look for different things. So everyone, you got gold standard stuff here. Michelle, thanks so much for joining me, and follow her, do what she's doing, and then question authority sometimes and say, let me try it for a little while, and then maybe I'll make these changes. But nonetheless, no one gets worse if they focus on stress and faith and sleep and taking care of people and being kind and all these things. That's never going to be. No one ever said, like, I used to be so healthy, and then I started being nice to people, and my health went in the trash. Right? I started taking care of myself, and everything fell apart. But that's the other thing we talk about too, Michelle, a lot, is a lot of people are caregivers and they care for everyone else except themselves, and they're the last to. They think they're selfish if they say, I'm going to go get a massage, or I'm going to go for a walk in the park by myself and not take care of grandpa and grandma for a day type thing.
Yeah, it's amazing how better my life has been. Prioritize myself, and that's hard. We're not, especially women, we're just not taught like you must take care of yourself first. Like we'll take care of our kids, the relatives, everybody else, but then you're empty, and so it feels a little foreign, but it's actually one of the best things you can do is put yourself first.
There you have it. Everyone out there, be kind to yourself, be kind to others. Play this one back a couple of times because there's so much wisdom here that Michelle's given us. So hope you have a great day, and blessings to you.
All right, talk soon.
All right, Michelle. Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify, or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.